everyone, myself Priyanka Jirayal, working as Associate Program Manager in GD Goenka Healthcare. What are needle stick injuries and also known as NSI? Needle stick injuries are wounds caused by needles that accidentally puncture the skin. Needle stick injuries are a hazard for people who work with hypodermic syringes and other needle equipments. These injuries can occur at any time when people use, disassemble or dispose of needles. When not disposed of properly, needles can hide in linen or garbage and injure other workers who encounter them. What are sharps? Sharps includes needles as well as items such as scalpels, lancets, razor blade, metal wires or any object that is able to cut the skin can be considered as a sharp. What are the hazards of needle stick and sharp injuries? These injuries transmit infectious diseases, especially blood-borne viruses. Concern includes the HIV, cause AIDS or hepatitis B and hepatitis C. Incidental puncture by contaminated needles can inject hazardous fluid into the body through skin. Even small amount of infectious fluid can spread certain diseases. Sharps can create a cut in the skin which allows contact between blood or fluids. The risk of infection after exposure to infected blood varies by blood-borne pathogen. How do needle stick injury occurs? Needle stick injuries can occur at any stage of the use, disassembly or disposal. What to do when you have needle stick injury? If you get stuck with a needle, get quickly with HIV treatment works best when you get it within 72 hours of encounter. Wash it, clean any accidental stick right away, rinse, wash the area with the running water, not to use any antiseptic or disinfectants. Find it out as much as you can about the person or person who used the needle before you. It's important to find out if they could have HIV, hepatitis B or hepatitis C. Immunization shots, some vaccine like diphtheria, hepatitis B can help your body immune system to kick in and protect you from those infections. Post-exposure prophylaxis, which is also known as PEP, antiretroviral drugs don't kill viruses. But a short course of these HIV medication taken 72 hours of your exposure to the virus may keep it from taking hold in your body. Reported half or more accidental injuries from needles and other sharp medical instruments go unreported. So it is important to report your incident. How can needle stick injuries can be prevented? Preventing injury is the most effective way to protect workers from needle stick injuries. So, needle should not be recapped. Used items should be placed immediately into designated puncture-resistant container that is easily accessible at point of care. Use of SED safety engineer devices can prevent needle stick injuries. Healthcare workers should cover open skin areas or lesions on hands and arms with a dry dressing at all the times. Hand hygiene is still essential, so consultation is necessary if the dressing interferes with this procedure. Thank you.